Good morning, DXN. Welcome to DXN, the world's largest Ganoderma producer. Started its journey in Jitra, a small town in Kedah, Malaysia in 1993.
Good morning again to good morning DXN, good morning to everyone. So we'll be talking about skin awareness or paano po natin ma-check kung meron po tayong mga skin problem and how to prevent this problems, especially mga cancers or mga bukol po. So maybe show po the slides. So, while waiting po, ilang introduction for this month po, especially ngayong summer, very yung sunlight natin, usually direct and very harmful to the skin. So, in this talk or awareness, malaman po natin kung ano po yung mga important na kailangan gawin. So again, Skin Cancer Awareness Month. May is Skin Cancer Awareness Month po. In 2021, for second straight year, Skin Cancer Awareness Month takes place during the COVID-19 pandemic. More than a year na po yung COVID pandemic po natin. With over 5 million cases diagnosed in the United States. And then each year, skin cancer is America's most common cancer. So next slide, please. So skin is the largest organ of the body. So it's also called an organ. Just like the ibang organs sa body natin, it is also important na we keep safe o pangalagaan po natin ang ating skin kasi it's also an organ because una, it protects us against infection and siya po yung unang line of defense natin for infection, our skin kasi it's a tight and it covers all mga blood vessels natin and mga tissues. So it protects us from infection and injury and helps regulate the body temperature. It also stores fat and water that produce vitamin D. So basically vitamin D po, makukuha po natin yan through pag magpapaaraw po tayo, especially dun sa mga important time lang po, yung very early in the morning and the late afternoon. And with that, it can help sa production po ng vitamin D. And vitamin D helps in our bones to strengthen them. So it is the most common cancer in the United States. 1 in 5 Americans will develop skin cancer in their lifetime and nearly 20 Americans die from melanoma. The deadliest form of skin cancer every day, about 90% of non-melanoma skin cancers and 85% of melanoma cases are associated with exposure to ultraviolet radiation from the sun. So yung ultraviolet radiation, ito po yung mga sikat ng araw na hindi po pansin sa mata, the ultraviolet or the blue rays, and they can cause damage sa ating skin cells and the DNA. And once na ang madami sa yung DNA, it can cause mutations po and then growth of mga bukol, doon na po magsa-start. So, next slide. Ito lang po yung mga layers po ng ating skin. So, we have the epidermis, which is the most outer layer. Ito po yung manipis na balat sa po natin. Nandiyan po yung mga dead skin cells and then they protect us from our infection. The dermis, the inner layer of the skin, as shown in the picture, siya po yung parang pinkish area. And then, nandun na rin po yung mga hair follicles. Then, the hypodermis, the deep layer po, ito na po yung fat. Once na ma-injure na po to around the hypodermis, din na po tayo magkakaroon na po ng bleeding. Next slide, please. So cancer starts when the healthy cells grow out of control, forming a mass called tumor. So ito po yung explain ko a while ago. Once na-destroy na po ng UV light ang ating cells or the DNA of the cells, they start to become uncontrolled. Tuloy-tuloy po yung growth ng cells. Hindi na po sila usually po cells are mabubuhay, then eventually, in a time, mamamatay po sila. So, dun po natin makikita mga dead skin cells. However, for cancer po, tuloy-tuloy po yung buhay po nila and then they reproduce, parami ng parami hanggang sa mag-form po ng bukol. So, tumor can be cancerous. Ito po yung cancerous na tinatawag o malignant. Ang ibig po sabihin po nito ay kumakalat po. Yun po yung delikadong kind ng mga bukol. Dahil pag kumalat po, pwede pong mapunta sa iba't ibang parte ng katawan at tumubo po doon at hindi na po natin makita yung mga tumutubong yun. At doon na po natin makita na stage 4 na yung cancer natin. And then, the other one po yung benign. Ito naman po yung hindi kumakalat. Palaki lang po ng palaki. Ang maganda po dito, tatanggalin lang po siya. So, wala pong problem with the other parts of the body. And then, cancerous tumor is malignant. Yung nga po sinasabi natin kanina, it can grow and spread to the other parts of the body. Benign tumor can grow but will not spread. So, the most common type of cancer po yung mga benign. However, it is still important na makita po natin, mamaya papakita po natin yung mga kinds of skin problem o skin lesions na tinatawag o mga kakaibang changes sa skin para makita natin kung ano yung okay lang, tapos ano yung po yung parang cancerous na. So, it is found early. It can be treated with topical medications or pwedeng matanggal through surgery by a dermatologist or plastic surgeon. So, dermatologist is a doctor who specializes in disease and condition of the skin. So, with this skin cancer awareness lecture, we'll see different kinds of skin lesions or skin changes na magwawarrant o magtutulong sa atin to seek to consult for dermatologist. Doon po natin makikita na kailangan na natin magpatingin sa dermatologist para magawa na ng tamang solusyon yung ating changes sa balat na hindi na po ganun kaganda. So, skin cancer is responsible for less than 1% of all cancer deaths. So, this data from the United States. So, moving on po for 4 main types of skin cancer, after which po, we are going to show the pictures and from that, it can help o maging aware po tayo kung anong nangyayari sa balat po natin. So, the first one po is basal cell carcinoma. This explanation is round cells found in the lower epidermis. It develops 80% from this type of cell. Normally develops on the head, neck, caused by sun exposure or develop in people who receive radiation therapy. So yung mga radiation therapy, yung mga ibang cancer, they need radiation therapy. So prone sila magkaroon ng skin problem. It slowly grows and rarely spreads to other parts of the body. So next is the squamous cell carcinoma. The epidermis is made up of flat scale-like cells. Ito po yung mga squamous cells na tinatawag po natin. Ito po yung pinaka-outer covering and then they are called epidermis. So 20% of skin cancers develop from these cells. It is mainly caused by sun exposure. So main po yan kasi dahil sa ultraviolet rays which diagnose on many regions of the skin. It can also develop on the skin that has been burned, damaged by chemicals, or exposed to X-rays. So all of them radiation or ultraviolet. And then chemicals naman can cause changes din po sa DNA, damage po sila and then cause some mutations, tapos nagli-lead po sa overgrowth or pagdami. Hindi na po mapigil ang pagdami. It is commonly found on the lips, on the skin, outside the mouth, sa may bandang likod po and sa women's vagina. So 2% to 5% spread to other parts of the body, which makes it more likely to spread than basal cell carcinoma. So moving on po. So Merkel cell carcinoma, also known as neuroendocrine carcinoma of the skin, a highly aggressive or fast-growing rare cancer. So this is very rare. So once na makita niyo po yung picture na to at medyo malapit po yung itsura, we need to consult our dermatologist. It starts hormone-producing cells just beneath the skin in their hair follicles. It is usually found in the head and the neck. And next one is melanoma, yung mga mga mole o mga nunal. The epidermis, mesodermis, there are scattered cells called melanocytes. Melanocytes po, sila po yung nagpo-produce ng mga pigmentation o yung pag-darken po ng skin. Sila po yung nagkakos ng morena or medyo brownish skin po. And this kinds of skin helps us to block po ultraviolet rays. So actually healthy po yung skin natin mga Filipinos kasi the brown skin helps fight off ultraviolet rays. Comparing to Caucasians o yung mga Americans kasi white sila and they don't have much melanin. Cells produce the pigment melanin which gives color to skin. Melanoma starts in the melanocytes. So if ever hindi po makontrol yung growth nila, nagiging melanoma po yung melanocytes o yung melanocytes are the cells po na nagpo-produce ng melanin. It is the most serious type of cancer. However, yun po, Merkel cell din po, one of the aggressive. So, next slide please to show the pictures po. Ayan. So again, so if we are going to examine, it's very important po na i-examine natin yung body natin for these kinds of changes po sa balat. Especially, makikita niyo po yung mga border nila, hindi po ganun kaganda. Like the basal cell carcinoma, hindi po siya rounded. Medyo jagged po yung gilid. Lalo na po yung squamous cell. Ano po siya, parang medyo nabubulok na po yung gitna. Kasi tuloy-tuloy po yung production at nawawalan na po ng blood supply sa gitna yan. And then for the melanoma naman po, we need to check for the size, kung growing, kung medyo ano na po yung sides niya, hindi na po smooth. And then for the Merkel cell, so we need to check for this kind of very aggressive po sila. So again, for skin cancer, medyo madali po kasing ma-diagnose to kasi we can see them. So it is important na we always check all the parts of our body. Pare maliligo kayo, try to check through the mirror, mga changes po na ganito sa balat. Okay, next slide please. So 6 surprising places skin cancer develops. Skin cancer develops in people of all ages, races, and nationalities. It can also develop on any area of the body, including the 6 unlikely places. So we can see na ito pong ibang areas dito, hindi po sun exposed. However, yung iba po, like the lips, the hands, the feet, the eyelids, exposed po to ng sun. While the scalp, which is covered by the hair, can still cause growth po ng skin cancer. And then the other part is the groin, which is sa may bandang part po ng ari na yung sa mga singit, pwede pong mag-grow po din yung skin cancers. Next slide, please. So there are 2 types of sunscreens. So we have the physical sunscreen and the chemical sunscreen. Medyo maliit po yung ano. The physical sunscreen works like a shield po, and then it is used for people na sensitive po yung balat. And this helps to block po the UV rays. While the chemical sunscreen naman po works like a sponge o yung nagsisipsip po sila ng UV rays. So however, it is medyo mahirap po yung for sensitive skin, medyo hindi po ganun kaganda yung chemical sunscreen po. Okay. Ayun. So we have, again, 2 types of sunscreen, the physical sunscreen and the chemical sunscreen. And then moving on po for the next slide. Tips when applying sunscreen. So we need to choose our sunscreen or our sunblocks. We need to check if meron po siyang SPF of 30 or higher and is water resistant para if ever pagpawisan, hindi pa rin siya matanggal and provides broad spectrum coverage. So apply sunscreen before going outside and then apply do sa mga areas na tinatamaan ng araw. Apply sunscreen to all skin not covered by clothing. Yan. To remain protected when outdoors, so we can reapply po the sunscreen every 2 hours or immediately after swimming or sweating. Next slide. So how to prevent skin cancer po? So we need to seek shade when appropriate. sun rays, especially mga 10 a.m. to 2 p.m., yung araw po kasi is directly on top of us. So, yung pong araw na nasa taas natin, siya po yung pinakamalapit sa atin. So, the rays are very, very strong po. So, kung yung shadow nyo po ay medyo maliit, hindi nyo po masyado nakikita, most likely the sun is on top of you. So, the strength of the ultraviolet rays are stronger. So, wear sun protective clothing, wear a lightweight and long sleeve shirt, pants, a wide brim hat, and sunglasses. So, important din po yung sa mata. Natatamaan din po sila ng UV. So, they can also cause blurring ng vision if ever our eyes are always exposed to sunlight. For more effective protection, select clothing with an ultraviolet protection factor. You can see a number on the label po in the UPF. Next one is for hindi po covered ng damit. We can apply sunscreen again with an SPF 15 or 30 or higher to all skin not covered by clothing. And we can reapply if ever you're working outside or on the field. Every 2 hours po tayo maglagay ng sunscreen. So use extra caution near water, snow, and sand as they reflect the damaging rays of the sun, which can increase your chance of sunburn. So for also, mga areas na mayroong white, masyadong matingkad na wall, pwedeng mag-bounce po yung sunlight. So, extra caution na lang po sa gantong areas. And then the snow and the water and sand po. So, avoid tanning beds. Ito po yung mga parang may ultraviolet ilaw pang patan. So, we can avoid this. So, they're direct ultraviolet light and can cause skin cancer and premature skin aging. So, consider using a self-tanning product if you want to look tan, but still continue to use sunscreen with it. And ito yung explanation. Perform regular skin self-exam. So, all the parts of your body, always check, especially the back. You can see through the mirror or try to touch your back for any yung pong roughness, hindi na po siya smooth. And sa mirror naman po, we can see some changes po. So, important na we always check for our skin. So, if you notice new or suspicious spots in your skin or anything changing, itching, or bleeding, so we need this to be seen by an expert po or a dermatologist. So, tips on how to look for a sunscreen. Broad spectrum sunscreen, it protects skin from the sun's harmful. So, ultraviolet A, UVA, and ultraviolet B, UVB. Yan po yung ibig sabihin nun. And these are the rays of the sun or na nagkukos ng burning, which helps prevent skin cancer, early sign aging, premature age spots, wrinkles, and sagging skin and sunburn. So all of which this sunscreen can help with premature age spots, wrinkles, and sagging skin. So we need to check for the SPF, or also known as sun protection factor, SPF of 15 or SPF of 30, both of which can block UVB rays. So anything with SPF is helpful for the skin. Pag po may mga SPF na more than 30, I don't think na po yun, kung meron na po talagang ganong kataas. So usually SPF 15 or SPF 30 po. We need to use water-resistant sunscreen. The sunscreen stays effective for 40 to 80 minutes. And the water, after that, you need to reapply. So, check din po natin kung water-resistant. Kasi lalo na sa Philippines, medyo tropical. Mabilis tayong pagpawisan, nag-wear off o natatanggal po yung sunscreen. And then, we just have a short clip po for skincare. So, technical, kindly. Play the video.
The skin is the largest organ of the body. It serves many important functions, including protecting the body from infection and regulating body temperature and fluids. The skin is primarily composed of 3 layers: The epidermis is the outer layer of the skin and contains basal and squamous cells. Melanocytes are also found in the epidermis. These are cells that contain pigment, which allows the skin to tan and which also protect the deeper layers of the skin from the effects of UV sunlight exposure. The dermis, which lies below the epidermis, contains blood vessels, connective tissue, hair follicles, and sweat glands. The subcutaneous layer, which is the deepest layer of skin, contains fat cells and collagen. Skin cancer occurs when there is an uncontrollable growth of abnormal cells in a layer of the skin. There are 3 common forms of skin cancer that are distinguished by the types of cells affected. Basal cell carcinoma is the most common form of skin cancer. This type of skin cancer does not typically spread, but does require treatment. Basal cell carcinomas most often develop in areas of the skin exposed to the sun. Squamous cell carcinomas develop in the middle layer of the epidermis. This type of cancer can spread and can be life-threatening if not treated appropriately. Abnormal growths of melanocytes, called malignant melanomas, are the most aggressive form of skin cancer. Melanomas can spread quickly to other parts of the body and to organs. This type of skin cancer can be fatal if not detected and treated early. People with fair skin are at increased risk for developing this form of cancer. Increased sun exposure and a history of sunburns increase the risk for developing skin cancer.
Ayun. So, we had a short bit po. And for our parting words po, skin cancer is one of the most preventable forms of cancer. Kasi po, the skin is easily seen and accessible. Very obvious po pag may mga changes. So, I don't think may mga tao po na mabilis mamamatay sa skin cancer kasi the changes is seen agad-agad. So, with these changes, ma-push na po tayo or mag-seek na po tayo ng consult. So by sharing facts about the dangers of unprotected exposure and encouraging people to check their skin for warning signs, we can save and will save lives po. So moving on to our our products in DXN. So we have Ganoderma, very known as a king of herbs for its precious medicinal uses for more than 2,000 years in China, and it has a lot of major elements, polysaccharides, adenosine, and triterpenoids, all of which can help in preventing cancer po and overgrowth or sudden yung sinasabi nating hindi mapigilang pagtubo po ng mga cells natin na nagiging bukol po. So this is a kind of mushroom used by the Chinese, Japanese, Taiwanese, and Koreans for centuries to promote longevity, stamina, and health. So again, nagawa na po sila into capsules, the ratio gano, which is used to help detoxify the body system and normalize the entire body function. And mga nagbabalance naman po natin yung the GL is the 14-day-old mycelium and helps in balancing body functions, thus improving well-being. So ito po dalawa comes together po. Next po is spirulina, is a type of blue-green algae or cyanobacteria. Very alkaline and helps in our alkalinization po ng ating body. Kasi pag acidic, more of pwede tayong magkaroon ng mga sakit with acidic environment. So it's suitable for children, adults, and senior citizens. Available in tablet, capsule, and cereal form. So marami na po tayong pagpipilian. So pwede na po sa bata through cereal and the tablet and the capsules po. And then, ito po the DXN spirulina farm. We can say na safe po yung ating products because only DXN produces our products. And may sarili po silang farm. It's the first direct selling company in Malaysia to produce spirulina from the cultivation process to finished goods. So, wala pong ibang dinadaan ng third party o lahat po from DXN lang. So we are assured na safe and clean and quality po yung goods natin. So DXN spirulina. So next po is bee pollen. It's an ideal dietary supplement which is highly regarded health food through the ages. It is a natural source of protein, minerals, and amino acids and enzymes. So regular consumption of bee pollen assists in the maintenance or improvement of general well-being. And also helps rejuvenates our body, stimulates organs and glands, enhances vitality, retard normal aging effects, improves fertility in women, and reduces excessive cholesterol levels. Next po. So bee pollen, produced by good manufacturing practice, certified factory with exclusive laboratory and state-of-the-art equipment. Strictly quality control. So ito pong bee pollen natin can help in our skin because it has vitamin E and it helps po to rejuvenate our skin po. Next slide please. Ayan po, the DXN Aloe V series. So we have 7 special variants po, the cleansing gel, hydrating toner, aqua gel, nutri-cream, hand and body lotion, facial scrub, and hydrating mask. All to help our skin po. So isa-isahin po natin products. So it's specially formulated using aloe vera extract with a blend of other beneficial botanical extracts to hydrate and soothe skin while preventing a breakdown of the skin's protective barrier. So ano po yung benefits ng aloe vera natin? Helps provide incredible soothing and hydrating properties. So it is important to hydrate our skin kasi pag po medyo nagbi-break siya or dry, mabilis po yung entry ng infection natin kasi nawawala po yung protective layer if it is dry kasi it's nagka-crack po and meron pong door yung bacteria to enter the body. So it contains over 75 nutrients and active compounds including nitrogen, polysaccharides, vitamin, enzymes, amino acids, and minerals such as calcium and sodium. So it helps transport healthy substances through the layer of the skin and helps restore skin's natural defense system and moisture barrier. Also helps prevent skin discomfort and sometimes it is used sa burn po para medyo masuten yung pain and it also helps stimulate cell renewal. Next slide please. So the first is the cleansing gel. It's important to use this to remove mga dead skin cells, mga dirt, lalo na yung mga na-stuck po sa ating mga pores. So it's a soap-free cleansing gel that contains aloe vera extract. Gently cleanses and clears your skin and pores without stripping off its natural oil and maintain its moisture content. So it also helps maintain skin's natural pH. So it's important po na balance po yung pH kasi ito po yung pwedeng avenue po minsan or pwedeng dito pumasok po yung bacteria kasi pag nag-change po yung pH ng skin. So with balanced pH, you can give the skin soft, supple, and more radiant. Next slide, please. So next po, after doing the cleanser, we need to use a toner. So a hydrating formula that contains extracts of aloe vera, hazel, and amino acids, which acts as a special skin moisturizer. So it removes the last traces of cleanser and make up impurities, dull, and lifeless surface cell, thus providing good secondary cleansing. Very important po ang mag-toner pa tayo after cleansing because after cleansing po na-open po yung pores with the toner, it helps tighten the skin, the pores po. Thus, hindi po masyadong nakakapasok yung mga bacteria. So, ito rin po yung nag-help sa atin to prevent yung growth po ng mga pimples kasi it prevents bacteria from entering our skin. And also has a natural moisture, leaving it clean, smooth, balanced, and stimulated. DXN Aloe V Aqua Gel, the day cream, an easily absorbed, hydrating, and moisturizing gel that contains a blend of aloe vera extract, a special moisturizer, and humectant. helps maintain good skin structure and prolong a youthful-looking appearance, leaving the skin feeling soft and smooth. DXN Aloe V Nutri Care Cream, a rich night cream naman po sa gabi. Yung isa po for morning, and then this one po pang gabi naman po, that contains aloe vera extract and beneficial blend of botanical extract, which forms a protective film against moisture loss. So important po talaga yung moisture sa skin. We prevent dry skin to help prevent entry of bacteria. Moisturizes, comforts, and calms the skin while you sleep, helping to restore its natural defense system. Next slide po. Ito naman po yung for the body, hand and body. So, a non-greasy moisturizing lotion with aloe vera extract. So, ito lang po yung kanina for all the face, and ito naman po yung ating body ito. So, wag po natin i-mix yung nilalagay po natin sa face and then sa body kasi magkaiba po sila ng skin type. So, important po na wag po natin paghaluin. So, forms a protective layer which nourishes and guards against moisture loss, leaving your skin feeling refreshed, soft, and smooth. Next slide. Tapos, aloe vera facial scrub. A scrub which provides gentle deep pore cleansing to remove dull, lifeless surface cells and other impurities, leaving your skin looking smooth, clean, and fresh. So, formulated with aloe vera extract to lubricate and condition your skin during the cleansing process, protect it from drying and damaging effects. So, contains oil of olive and macadamia to suit your skin po. We have the Aloe V Hydrating Mask, a wash-off mask that restores instant moisture to dry and weather-damaged skin, yet is suitable for gently soothing and calming all skin types. Extract of aloe vera and natural derivative of olive provides excellent moisturization and soothing effects. So it also contains sodium hyaluronate, a moisture magnet that pull moisture deep into the skin cells, instantly leaving skin smooth and supple with a natural dewy glow. So next po na product line ko is Ganoji E-Series. So they are enriched with vitamin E and other botanical extracts to work synergistically to protect skin against skin problems resulting from busy lifestyle and the polluted environment while preserving skin's beauty. So it comes with 4 special variants. So important po na magamit po natin to. For first is the cleansing, after which we do the toner, and then kung anong cream po yung gagamitin natin if ever we are going out or matutulog na po tayo. So, doon po tayo mamili kung UV Defense Day Cream or the Nourishing Night Cream. So, isa-isa po natin. For the deep cleansing, it's a mild soap-free cleansing cream that deeply removes impurities and dead cells without drying your skin. Contains fruit extract that leaves your skin feeling revitalized. Also, for Ganoshi E-Series, meron po siyang Ganoderma, unlike po the aloe vera. Ito po, meron po siyang halong Ganoderma. So, imbis na iniinom niyo lang po, nilalagay niyo na po sa skin niyo. After cleansing po, we do the toner. It helps po to minimize the pores, helps prevent entry po ng ating mga bacteria. And with this toner, it can help to prevent po pimples. So, it penetrates and tones your skin from the deepest level. It contains fruit extracts such as bilberry, lemon, orange, sugarcane, and sugar maple, and also enriched with hydrating agents, leaving skin velvet soft and feeling incredibly fresh. So, unlike po the aloe vera, ito pong E-Series natin, meron po siyang SPF. So, a rich creamy moisturizer that hydrates, firms, and moisturizes your skin as it protects against UV rays, leaving your skin feeling velvety soft, smooth, and supple. The cream is enriched with vitamin E and a blend of botanical extracts. And then yun din po, meron po siyang some SPF, sun protection. And then for paggabi naman po, a rich and creamy moisturizer to intensely nourish when the skin naturally renews itself at night. So it helps po to nourish again your skin, revitalize, rejuvenates. Though the skin will feel softer and smoother the following morning. Added in this are botanical extracts such as Canadian willow herb, Commiphora, Mira, Fagus sylvatica, Ganoderma lucidum, horsetail, sunflower seed, yeast, and wheat germ help to improve firmness while strengthening the skin structure po. So, even though many of us are separated during this time of uncertainties, we can still unite against skin cancer. As one of the vital parts of our body, we need to keep our skin safe and protected, share the facts, and help save lives. So, yun lang po ang pinaka parting words is always check your skin, protect your skin from the harmful rays of the sun, and if ever may changes, always consult po a specialist for changes sa skin.
Make sure you find the time and spend some money for your health before it is too late. DXN products help your body to maintain optimal health. Give them a try, and you will feel the benefits of DXN products in a more natural way. Thank you for spending your time with us.